Hello, my name is Jennifer Ford. My MSN Based Quality Improvement Education Project is on African Americans with type 1 diabetes. 30 million Americans have diabetes. It is the seventh leading cause of death in the United States. Diabetes can progress faster in African Americans because of poor diet, obesity, and lack of physical activity. Limited access to health care, poverty, and cultural difference can impede African Americans from getting proper diabetes management. 37.3 million Americans had type 1 diabetes. The number of confirmed diagnoses of diabetes is 29.7 million people, and 8.5 million people are undiagnosed with diabetes. Type 1 diabetes leads to other complications from a lack of glucose like amputation, kidney damage, and eye problems. My population of interest is African Americans with type 1 diabetes. Why is this population important? 10.6% of African Americans do not have medical insurance compared to 5.9% of European Americans. Health disparities can lessen by concentrating on social determinants of health such as poverty, medical access, and racial discrimination. The National Vital Statistics shows that there are 4.9 million African American adults aged 20 and older with type 1 diabetes. 12.7 million Americans have a diagnosis of diabetes. The death rates for African Americans with diabetes was 39.3% of the population. 13% of African Americans have type 1 diabetes compared to 8% of European Americans. State vital statistics for Georgia. There are over 1 million people diagnosed with diabetes in Georgia. There were 74,000 new diagnoses of diabetes yearly in Georgia. There are over 2 million individuals in Georgia with symptoms with high glucose levels but have not been diagnosed with diabetes. People with a diagnosis of diabetes place a financial burden on Georgia of $11 billion per year in medical expenses. Local vital statistics for Carroll County. There are over 30,000 people in Carrollton, Georgia. The African American population makes up 34% of the population. Carrollton has 4,000 African Americans in poverty. The prevalence of diabetes in Carroll County affected 12.3% of the population. 11% of the population in Carroll County had a diagnosis of diabetes over the age of 20. Poverty ranks highest among African Americans in Carrollton, Georgia. Issue of concern: the African American population had the higher incidence of type 1 diabetes in the community associated with health care disparities. What are the likely reasons? Lack of resources, improper education, lack of healthy meals, inadequate medical treatment. 10.6% of African Americans do not have medical insurance compared to 5.9% of European Americans. Health disparities can lessen by concentrating on social determinants of health such as poverty, medical access, and racial discrimination. A review of literature was conducted to support the population of interest African American with type 1 diabetes. The first one done was by Berkowitz, who did a study, and the purpose of the study was to test if lifestyle changes in delivering healthy food improve outcomes for people with diabetes, and the findings did show that diabetes did improve with healthy eating. The next one was done by Spiriva. The next study was done by Spiriva. The purpose of this study was to assess how African Americans and amputation are associated with death and loss of independence, and it did show that African Americans have the highest number of amputations. The next study was done by Okora. The purpose of this study was to investigate African American women's opinions regarding healthcare systems and providers and assess their satisfaction level with care, and it did prove that people with a lower socioeconomic status did have poor health outcomes. The next study was done by White, who also conducted a study. The purpose of this study was to improve diabetes education using a quantitative method to collect data. The findings did prove that the focused health communication module was not more effective than regular diabetes education. Abasad RB Syed conducted a study, and the purpose of this study was to address disparities affecting glycemic control among people with diabetes by using a strength-based method focused on understanding resource and strength, and the findings did show that health disparities put minorities at a disadvantage and worsen diabetes. The next study was done by Terrence. The purpose of this study was to review trials of quality improvement interventions to decrease health inequalities in patients with diabetes in primary care setting, and the study did prove that education and income were two factors that affected inequalities in diabetic care. The next study was done by Walika. The purpose of the study was to identify the developments and reasons for amputations, discharge diagnosis, and the mortality rate after lower extremity amputation. The study did prove that diabetic patients have more amputations than any other chronic disease. The next study was done by Vu. The purpose of the study was to test if secure email from a primary care physician would improve the communication between the patient and the doctor and lower the glucose level. And the study did show that there were reductions in the hemoglobin A1C after a 12-month randomized study design. The next study was done by Lynch. The purpose of this study was to analyze if diabetes self-managed education effectively improves glucose levels, and the study did show that the hemoglobin A1C was decreased. The next study was done by Suklo. The purpose of this study was to determine if the involvement of caregivers would assist in prevention and management of foot ulcers from diabetes. The conclusion did show that improved knowledge did decrease the hemoglobin A1C and the foot ulcers in diabetes. Oh my goodness, look. This ain't working out. Oh no. A needs assessment was done for Carroll County. The gap analysis showed that African Americans do not recognize obesity as a problem. The African American population had a high incidence of diabetes. 24% of the population smoked, 35% did not exercise, and 43% were obese. Needs assessment SWOT analysis. Strength score treated all patients regardless of race or ability to pay. They were dedicated to improving the community to bridge the diversity gap. Some weaknesses that were the SWOT analysis revealed was long wait times in the emergency room and clinics, no continuity of care due to no primary care physician, and short staff in the emergency room and clinics. The needs assessment SWOT analysis opportunities for the patients were new and innovative technology, provided consultations, offered career opportunities, bridged the racial gap in the county. The threats that were determined were the rising cost of materials, limited supplies due to cost, lack of Medicare funding, competition from surrounding hospitals and clinics. The needs assessment windshield, JSU windshield, revealed that there were 2 major hospitals in the area, 3 high schools, 2 technical college and university. The community did provide social services to the community. The Carroll County is ranked in the high to middle range to health outcomes. The county had a high risk of no physical activity. The county has a high rate of no physical activity, but has increased access to opportunity to exercise and over 4,000 preventable hospital stays. The needs assessment key leaders identified that there were lack of education, high cost of medications, lack of medical access, lack of medication compliance, a high cost of medical care. Theoretical framework by Madeline Leininger. The culture care theory focused on learning culture, sharing cultures, and accepting culture. The culture linked to the African Americans because you have to customize teaching and plans of care to meet the needs of the African American community. And there are many different cultures within the African Americans, and you have to teach because no two people are alike. No two people with diabetes are alike. Another theoretical framework that was borrowed was Watson's philosophy, Science of Caring, made of 3 concepts: human being, health environment, and nursing, and focus on promoting health and treating the disease. It can be very difficult to communicate with providers, and this theory promotes developing a trust relationship to establish rapport with patients. Environmental, individual, and agent factors. Environmental factors are smoking, drinking, and genetics, and obesity. They all fit into the environmental category. Agent is the cause of the disease. Host is who can get the disease. Type 1 diabetes is inherited from both parents. The agent factors are obesity, poor diet, smoking, and lack of exercise. Primary, secondary, and tertiary prevention. Primary is a preventive measure that prevents the onset of illness or injury before disease begins. An example of this is outpatient community affairs. Secondary is prevention. Prevention is a screening to recognize signs and symptoms early in the disease to prevent more severe problems from developing. Outpatient checking blood sugars and screenings on outpatient basis is an example of secondary. Tertiary prevention focuses on recovery following their chronic illness, and basically, an example of tertiary is basically you help the patient and families cope with the impairment or disability that is already present. Evidence-based quality improvement education plan. We use newsletters, education handout, PowerPoint, group educational sessions, posters, and flyers to meet the community, to give to the community. 3 community diagnoses: knowledge deficit related to availability, the alteration in health management related to chronic disease, lack of access to health care related to the cost of medication and primary visits. The primary community diagnosis related to available resources is community knowledge deficit related to available resources evidenced by increased diabetes in the African Americans. The 5 roles of the APH is collaborator. Basically, you collaborate with the social worker, case manager, physicians, and nurses to ensure the patient get what they need from their appointments and their medications. The educator works with individuals to eat healthier, exercise, check blood sugars, and take their medications correctly. Clinician provides preventive care and manage diabetes by ordering tests and interpreting what these test results are. The researcher focuses on socioeconomic factors that affect diabetes in the African American community. An advocate is visible in the communities and support health programs that will better the community. Population interest of focus, engage the community to bridge the gap, reduce the risk of factors of diabetes through education, reduce the factors of diabetes of doing education courses weekly based on evidence practice, reduce unhealthy eating by doing a nutrition class, offer education to all stakeholders by using evidence-based approach to manage diabetes. Measurable plan goals: 50% of the participants score 75% or higher on the pre-test, 80% score 90% or better on the post-education quiz, 90% of the participants in the clinic setting score at 95% or higher on the post-learning assessment. 100% of the participants improved their scores from pre-post to post-learning assessment. 90% of officers identified the organ that produces insulin. Budget timeline: we provided a room, we provided material, cartilage, pens, paper, snacks, glucometer, and a blood pressure cuff. The budget was $115. During the timeline, we planned, designed, and created education materials, attended meetings with the preceptor, completed a literature review, completed a needs assessment. The barriers and challenges are limited attendance, inability to reach the citizens of the community, limited advertisement due to cost. In the clinical setting, we involved in understanding type 1 diabetes, connecting with patient and families to clinic, a center care team, use strategies to identify ways to improve diabetic care for African Americans, identify barriers for treatment, and display visual aids. In the community outreach, we displayed the visual aids, supply all participants with education material, offer free unbiased diabetic education, monitor glucose outcomes, and consists of a multidisciplinary team to educate diabetes in the community. The project evaluation: in the clinical setting, this project reached newly diagnosed African Americans with diabetes, decreased visits from patients to the emergency room that receive education on diabetes, better scores on protests. The community outreach prepared African Americans with type 1 diabetes with skills and confidence to manage the disease. The outreach offered easy to read and tangible information and gave support to the community, and allowed participants to build a connection and support each other. Future recommendations: add social media, delegate more responsibility to the staff, establish a partnership with the key holders, and lobby early to pass the policy to implement the education program. In conclusion, decrease in visits from patients to the emergency room that receive education, receive new diagnosed patient with diabetes, provide simple steps to manage diabetes, and provide education for patients and families. And here's a reference that you can review. Thank you.